All right, we'll go ahead and get started. So before I start here, just a quick announcement. So the MCTTD portion, we don't have a ton to cover today, so we probably will get done just slightly early. But I will ask that MCTTD participants stay on right after I'm done because we do have a gentleman, Dr. Sag Anna, coming from the Inhale CQI to discuss a joint collaboration between MCTTD and Inhale. So Dr. Sagnana we're partnering with Inhale to offer maintenance of certification points for our CQI participating providers. Dr. Sagana is a clinical associate professor at Michigan Medicine. He's a practicing adult pulmonologist with specific interests in COPD, lung transplant, patient safety and quality improvement, and clinical simulation. He works as a content expert and PO clinical champion for the Inhale team, and he'll be providing the basics of the maintenance of certification program, and that'll be right at the very beginning of the Inhale portion of this meeting. So like I say, please do stay on right after I'm done, and I'll give you a reminder after I finish MCTTD slides. And then after Dr. Sagana is done, if you do not participate in Inhale, you could drop off as you normally would. So with that, we'll go ahead and get started on our normal slides here. So our agenda for today, we're going to discuss a little bit about our PO one-on-one calls. We'll discuss the PO forum discussion, the regional meetings, both the fall and spring regional meetings. We'll discuss a little bit about the PO reports, and then we'll have a reminder about our VBR that we discussed at last month's PO calls as well, and then just some general housekeeping announcement and reminders about how to select your QI focus, reviewing the A1C and BMI submission rates, the expansion of the CGM user experience program, and the new VBR metrics and PO scorecard being displayed on the dashboard starting in September. So as a reminder, MCTTD is hosting PO one-on-one calls. We started those calls back in July, and then at each of the PO monthly calls, we'll provide you guys with a brief overview and takeaway of the previous month's calls, just so that we can kind of keep you guys in the loop as to the feedback that we're receiving as we go. And so these are a couple of the themes that we've received from those calls. So there was a request, a few requests for more low carbohydrate diet resources. So these are some of the resources that our team currently has in progress. So those include a low carb diet intro video series for patients, a group of culturally specific meal plans, which is really exciting. And then a resource celebrating cultural diversity in cultural diversity food swaps. So talking about foods that you can swap out for different foods that are low carbs as they pertain to culturally specific recipes. An analysis that our team did on low carbohydrate protein shakes. It's going to be a blog post, but our team met up and did a bunch of taste tests of some low carb shakes and ranked them, and has a resource being developed now based on taste as well as their nutritional content. And then finally, still doing some video editing with a low carbohydrate cooking demo that we recorded this summer as well. An additional set of feedback here that we've received a few times is requests for a phone app that houses all of the MCTTD tools. We have started to scope that project out and hope to launch that early to mid 2024. And then different views of the coverage tracker. So showing it by insurance, for example, rather than by medication, and then having it subdivided by insurance and then showing the different medications within that insurance rather than all of the insurance providers that cover a specific medication. Opportunities to meet with other practices with the same size and structure. For example, Henry Ford meeting with Corwell to get tips and tricks and to bounce ideas off of each other. A checklist of yearly requirements with deadlines. We are working on that. That is something that we have in the pipeline to be able to provide you guys so that you have something tangible with everything listed in one place that will be forthcoming. A very brief monthly digest for POs that has upcoming deadlines and deliverables or important information, pretty much everything that we're providing to you guys on these calls, but some form of something in writing that's not a PowerPoint slide, even though we do send these out. Definitely sensitive to the fact that PowerPoint's not always the best resource to be able to go back and view and be able to remember the important details. And then a payment schedule. We did ask Blue Cross Blue Shield to develop a 3-year payment schedule to be able to give you guys to let you know when to expect payments for your VBR. And then a mid-year optional call for any providers that participate in MCTTD in order to get a state of the state from the program directors, the MCTTD program directors, where we'll discuss what's going on with MCTTD, our future plans, and any future directions that we need to make everybody aware of. And then finally, just the final scorecard distributed for VBR. And so we've had a couple of questions about when that'll be distributed, and that will be forthcoming as well. And there'll be some more details on that later in this presentation. So PO Forum, one of the requests that I mentioned was from the PO monthly calls was to create this forum in order for questions to be able to be asked, where a PO can submit a question and get responses from other members of the collaborative, not just from the MCTTD Coordinating Center. So this is something we wanted to open up to the group and kind of get an idea as to what you guys think would be the best format for us to do this in, whether or not you'd want it to be built out in the administrative portal and just have it kind of be like this platform in there where you can post questions and then other members of the MCTTD collaborative could respond, or if it would be better to have like a listservs type email. And if it was to be built out on the administrative portal, is it something that you would want to get notifications for, or have like a weekly digest that's sent to everybody's email, or only have it visible if you were to log in? So if you have thoughts on that, please do put those in the chat or email us at the CC Teams email address. That's ccteams@mcttd.org with any thoughts that you have on that, or feel free to unmute. I'll pause for just a moment if anybody wants to say anything specifically on this call about their input on that. Okay. Feel free to put any comments or thoughts in the chat too as we go, if ideas come to your head or if preferences pop out to you. So we have one chat here. So Jenna said, I prefer having on the portal and like a weekly digest of the questions that have come in. Okay, great. Thanks, Jenna. So I'll keep monitoring the chat too. Laura agrees. Okay. And then one of the things that we could do also is have some adaptability with the portal. We could have where you can like subscribe to alerts, and so that you wouldn't necessarily have to get alerts. So we could have some flexibility there where if you wanted to get like a weekly digest, you could subscribe, or if you didn't want to have alerts and just when you logged in, then that would be something that we could have at an individual person level. All right. So our fall regional meeting schedule is here. All holds have been on your calendars for quite a while now for the fall. You'll be able to view registration on the administrative portal. So it will be open by the end of this week. So as a reminder, one of the scorecard metrics is to ensure that your clinical champion or a substitute for that clinical champion does attend your region's regional meeting. So if you do have any practices participating that you know are already having issues with coordinating that, please reach out to us and let us know. Just as a reminder that this is a part of the scorecard, and if the clinical champion cannot attend, a substitute can go in their place. All right. So this is the tentative agenda for the fall. So we'll be starting the meeting with some updates, talking about coverage changes, prior authorization laws, navigating resources, and the upcoming learning community events. We're going to be talking about some CGM opportunities by Dr. Oshman. Some more details to come on that. We'll take a short break. From 7 to 7:30, we'll talk about the MCTTD focused initiatives. So we'll likely break you guys up into groups and have you talk with other folks that are working on the same VBR, either the CGM, low carb, or medications initiatives that we'll talk about and give you another reminder about later in this presentation. And then we'll bring you guys back together and end the meeting with a session discussing burnout. All right, so looking forward now to the spring regional meetings. These are the dates for the spring. Holds have not yet been sent out to you guys. They will go out by this Friday. And so we keep trying to schedule these further and further out in advance to give you guys and their practices as much warning as possible. And so after we have these scheduled and towards the end of the fall, early winter, we'll start looking at scheduling for fall 2024. But like I say, holds will go out for these by the end of this week to both the clinical champions at the practices as well as the PO admin leads and primary contacts at the PO. All right, so regarding the quarterly reports, and so we did send those out, the first round of them, to you this past Monday, the 7th. You should have received these via email directly to the PEO Clinical Champions and primary contacts. It was sent as an attachment to that email as a PDF. There was a survey linked in that email. Please do complete that survey that was distributed along with them. It's very helpful for us as we iterate these reports. So we'll be iterating based on two factors. One, the availability of new data sources as it comes in, as well as the feedback that we receive from you guys on those reports. The next edition of those reports will be distributed at the end of September, and like I say, we'll incorporate any feedback that you give us before that into that next round. And then, like I say, as we get more additional lab sources and data sources, they'll become more robust and be able to have more in-depth analyses done on them. So coming soon, review the PCP VBR list. So Blue Cross Blue Shield is reviewing the physicians that we submitted for VBR for the upcoming performance year. They're not quite done yet, but when they are, they will generate that list of physicians who are approved and those that are not. We'll post this list on the administrative portal for you for you to be able to go in and review. We'll let you know, obviously, when that is posted. When we do let you know, please do go in and review it as soon as you can, so that we can account for any corrections or changes that need to be made. So required turnaround time on this will be quick, likely 1 week, just due to some time constraints waiting on this from Blue Cross and trying to get this back to them in time for the cutoff. There'll be two options on the administrative portal. This list is correct, or we need to submit changes. And if you do select that we need to submit changes, it will open a text box. Please include any practice unit IDs or NPIs of the physicians that either need to be changed, added, removed, so on and so forth. If you have any issues with that, like say, please reach out to either Jackie or I or the CC team's email. All right, so a couple of housekeeping items, reminders and announcements here. So as a reminder, the PCP VBR focus is now posted on the administrative portal. So starting back on August 1st, you'll be able to submit, you have been able to submit since then, your QI focus. An email was sent out announcing this. Please do go into the administrative portal and choose your PO's QI focus by the end of this month, by August 30th. And as a reminder, this is the process for that. So you can choose one of the three measures. So the low carb diet measure, the medications measure, or the continuous glucose monitors measure. And just as a quick note, as a reminder, all practices within a PO will work on the same QI. This is meant to be kind of organized and collaborative within a PO. So the first option, just as a review here, is a low carb diet. This is going to be a little bit different than the other two because of our limited availability of data for low carb diet tracking. And so these measures are based off of participation and development of action plans and reporting results, not based off of actual changes to the data. And so you'll notice that as you read through this in detail. And so it's really to develop an action plan to address either education or the support provided by the practices to implement that action plan and then report back to MCTTD about its outcomes. It'll be met by submitting the action plan and the reflection and conducting the meetings, again, not by specifically hitting numbers of patient-reported outcomes achieved or data metrics. And so the first step to this is distributing an initial baseline PROS set, and that'll be between October of 2023 and January of 2024. We'll work with each site on a target number of PROS, patient-reported outcomes, based off practice size and patient population. And then the second step here will be based on that PROS data to develop an action plan that makes sense based off of that patient feedback to implement around low carbohydrate diet support and education and deploy that action plan by February of 2024. Some examples of this action plan could be like creating a packet of resources, deploying the MCTTD developed introduction to low carb diet video series, or setting up specific follow-ups with patients to check on how their low carb diet plans are going. Step 3 will be to then collect additional patient-reported outcome responses from patients who both have type 2 diabetes and are on a low-carb diet between March 2024 and May 2024. Then evaluate to use that to evaluate the success of the implemented action plan. Step 4 will be then to submit a reflection based off of that feedback, whether or not it met success, whether or not it was successful, or if there was additional areas for improvement. And then the 5th step and final part will be to meet with other POs working on that same initiative, the low carb diet initiative, to discuss progress and challenges. And MCTTD as the coordinating center will facilitate that meeting with everybody that's working on this option. For medications, this will be based a little bit more based on the data that we have through the dashboards. And so the first step here is to review the SGLT2 and GLP-1 prescribing rates over time and develop an improvement plan. So like the same as for the low carb, the requirement will be met by submitting the goal, the planned process changes, and the lessons learned, not by specifically hitting targets of medication prescribing rates or anything like that. So step 1, again, review trending data through the quarterly reports, July and September reports, like say we just sent out the July ones, and the September ones will be coming out at the end of September. Determine your PO level goal, what you guys want to try to work on, what rates you want to try to hit, or changes you want to make, and submit that goal to MCTTD. Convene a meeting with your MCTTD participating practice clinical champions at least twice during this VBR phase. At the initial meeting, you would want to discuss practice level changes that support the prescribing goal that you've come up with, and then submit those changes, planned changes to MCTTD. That meeting should occur in the time frame of September 28th through November 15th. And for the data that will be coming your way in September, that'll go through June 30th of this year. The second meeting will be a check-in meeting just to review the data with practices and identify if progress has been made or if there are any changes that need to be made during that action planning phase. And then that meeting should occur somewhere in the vicinity of April 15th through May 31st of 2024. And then we'll be able to have data to you guys in follow-up PO level reports that goes through January 31st of 2024. And then fourth step and final step here is to meet with other POs, again, just like the low carb diet option, that are working on the medications option, and then MCTTD will help facilitate as the coordinating center as well. For CGM, the language on here is identical. The dates are identical. The only difference is that it's going to be looking at CGM prescribing rates for patients with type 2 instead of medication prescribing rates for patients with type 2. Dates are exactly the same. Requirements and meeting types are exactly the same. So I'll save you from me reading through all of this again. All right, so we have sent an email out to all of you guys letting you know that we have put on the BMI and A1C submission rates onto the administrative portal. So you do have the ability to go in there and see that. The total patients in PO refers to anyone that we've received PPQC data for. The submission count is how many of those patients that we've received data for have an A1C or BMI respectively reported, and then the submission rate is simply that rate divided by the total. And so do please review and answer the questions on the administrative portal about that by August 17th, if you've not done so already, just so that we have a better idea of how to structure this on the PO scorecard. We want to make sure that we're incorporating your feedback on that before we send out the PO scorecard. This is the final step that we need to check off before we can get that sent out to you, the PO scorecard, that is. All right, and as a reminder, we did expand the CGM user experience program. If you remember, it initially was open to just the clinical champions for each practice. We have expanded this to any physician participating in MCTTD or any advanced practice provider, meaning nurse practitioners and PAs that are working at an MCTTD participating practice. And so we sent out an email announcing this, and that went out to all of the PO clinical champions. And then those clinical champions could either forward it on to participants at their practice, or they could put in survey or interest forms for other physicians or APPs at their practice. And so the steps for how to do that are included in this slide here. If you need that email sent back out to any practices, let us know, shoot me an email, and I can send it to anybody specifically that we need to send it to. But so far, we've received 48 interest forms submitted that contained a total of 79 interested people. Like I said, a clinical champion could submit an interest form for multiple people at their practice. Of those 79 people that were submitted, we've received 25 attestation forms. As a reminder, if I go back a slide here, the step 2 and 3 is to review the CGM training video and then sign the attestation form that was completed. That is what we have to have signed in order to be able to receive the CGMs without a prescription from Abbott, and then be able to send them out to you guys off label. That is how the contract works. So we will be ordering the number of sensors that we have received an attestation form for. We'll kind of develop an arbitrary cutoff date for this, and then we'll be doing this in batches moving forward. This is something that we'll kind of continue to do in perpetuity as funds allow. We don't anticipate having any issues continuing this for the foreseeable future. But like I say, we will have arbitrary cutoff dates where we say, okay, we're going to order 25 in this case, CGMs, get those sent out, and then leave it open for surveys responses for maybe say 2 more months, and then do it again. So there'll just be some arbitrary dates for that. We will be putting this on the website and include those arbitrary dates for the cutoffs there as well. All right, so just as an FYI, new VBR metrics with the QI focus selection and PO scorecard tracking will be available on the dashboard, beginning the administrative dashboard, that is, beginning on September 1st, coinciding with the start of the measurement period. So just a quick note there for you guys. All right, and so our September PO meetings here will be on Wednesday, September 13th at 2 p.m. That one will be led by Jackie. And then on Monday, September 18th at 11 a.m. led by me. All right, as a reminder, please do stay on. I'm going to turn this over to the Inhale team, and Dr. Sagana is going to give that overview that I discussed before. Just a quick reminder that is regarding the maintenance of certification points that we're partnering with Inhale in order to be able to offer. All right, let's see here. Oops, Sean, I see it. Is Carla on? I know that Carla is leading this person. Oh, there you are.
I'm here. I'm not sure that Dr. Sagana is on quite yet, because we told him 2:30, because okay. Generally, so we may have, everybody can go take a stand up and walk around break, or we can start with our, and we are going to have probably people signing on at 2:30. So I think we're going to have to wait, unfortunately, until the 2:30 point. So I apologize for the delay.
Sounds good. Yeah, and like I say, if you're not able to stick around for some reason, let us know, and we can send you send you the information after the call as well.
Correct.
But if you do have the availability to stay on, please do so. Carla, I'm going to make you co-host here.
Thank you. I guess we can use this time for anybody that's on right now that has any questions about Inhale, just prior to getting started in general.
Or MCTTD for that matter. I'll stick around for a little bit too.
Questions?
If there was, yeah. Please feel free to unmute and speak up.
Absolutely.
Great question, John. So that is the patient's, so regarding John's question in the chat, for those that haven't seen it, John asked regarding the BMI and A1C submission rates, what insurers are included in the total patient count? So that is the same as what's available on the MCTTD dashboard, patient data dashboard right now. That includes Blue Cross Blue Shield, PPO, commercial, and BCN. So it is just those two right now. And as we've mentioned, we're hoping to have all payer PPQC data included in both the patient data dashboard and all of our analyses, either by the end of 2023 or very early on in the beginning of 2024. But as of right now, it's just Blue Cross Blue Shield, PPO, and Blue Care Network.
Dr. Sagana just messaged me that he'll be signing on right now. So,
Great.
although we still want to allow the people that are just coming on for Inhale to be available to be on there. So we can take care of that. I'm laughing at myself. I just almost ended the meeting for everybody because I was trying to get out of the chat. I almost clicked the wrong button and it just ended everything for everybody. Sorry. Maybe I shouldn't have all that power, Jake.
Uh-oh. All right.
See if we see Dr. Sagana. Not yet. Hopefully he's not having any problems getting on.
Hi, Dr. Sagana, can you hear us okay?
Perfect.
Yes, thank you.
Perfect. I'm gonna share my slides. Just we do have a slide for him too. So let me get, where's my, oh. There we go. I'm using it. There we go. So we're going to jump right in here. I think it's a little bit short. So I'm going to start with just the beginning, then we'll jump right into Dr. Sagana's presentation so the MCTTD people can leave. And I'm sorry if I'm going to look off to the my screen here. So just for Inhale people, just a reminder that the regional meeting registration, our invite was sent out on August 4th, and we want to make sure that your providers are registered by August 18th. We will be sending out these slides, so you don't have to write all this stuff down. The newsletter was sent out August 1st, and make sure you're sharing that with your providers and your practices. We're going to be talking about MOC, or maintenance of certification, with Dr. Sagana, and then Megan Spiroff is going to talk to us about our patient advisory board, building that. Reminders, just remember we have those resource bags. We'd love for you to order them. We have received a lot of reorders. We do have those bags now, and there'll be one per practice just to start off with. And that open invitation to join our education work group is still there. Our next meeting is August 21st. So this is for Dr. Sagana. Dr. Sagana is as Jake said in the beginning, is a pulmonologist here at Michigan Medicine with a particular interest in COPD, quality improvement, and lung transplant. So I will open it up to him. Dr. Sagana.
Thanks, Carla. Hello, all. So my role in Inhale is that I'm a content expert for quality improvement. So some of my research interests are in patient safety and quality improvement. And so as we were working on this endeavor, I wanted to see kind of what resources could we provide to our POs to help them with the upcoming projects. And so, as some of you may remember, we sent out a survey a few weeks ago as a type of needs assessment to see where POs stood in terms of their readiness to handle QI projects. And there were various or varied responses. One of the takeaways that we got from the responses, though, was that MOC was something that a lot of the POs did not seem to have experience with, and how to turn in quality improvement projects for maintenance of certification points for their physicians. And so we wanted to offer that as a service to the POs. And so Carla, we do this fairly regularly in my division. So we'll have a QI project that we run for our division. And then after like about 2 PDCA cycles, we will fill out a bunch of paperwork through our quality department and then submit that for me, it's ABIM. So that's my kind of professional organization for MOC points. And it's a pretty straightforward process once you kind of know what to do. So just to review what's on your screen. So what we're proposing is for POs that would like this, like the ability to turn in their project for MOC. It seems like we are agreeing upon inhaler education as the project for the POs. And so that will allow us to submit one kind of report to our quality department. They'll take care of the submissions and things like that. There's paperwork stuff that we can help out with. There is a cost associated with this if you are not part of Michigan Medicine. However, we worked it out with them where Inhale will take care of the payment for the project. And so interested POs will only have to pay $15 per physician that wants to submit the project and get credit for MOC. So there's more details that we can submit or we can review with the POs if people want to hear more about this in the future, but we want to at least put this out there for people to consider. And then if you are interested, we can send you some resources in terms of what kinds of things. So obviously the project will be inhaler education, but at what point would you be able to, submit this? So we have this timeline that we can send out. We also have kind of like a checklist almost of what needs to be done. Not like how to do it, but like you need to have at least, as I said, 2 PDCA cycles, things like that, so that when they're ready, that can be submitted. And then we will take care of the kind of bundling and working with our quality department to turn that in for MOC. So I can take a few questions right now if people have any questions. Otherwise, please contact, Carla or Kelly with additional questions, and I'll be happy to answer them in the future. So one question people may have is how many points do you get for this? And so technically, when you turn in MOC to say like ABIM, American Board of Internal Medicine, you're supposed to get 20 points, but somehow Michigan Medicine has worked it out that we get 30 points for turning these in. So I don't know if it's some kind of special deal they worked out, but between 20 and 30 points for turning in from one project. All right, so with that, I'll step out. And then if you have any questions, please reach out, like I said, to Kelly or Carla, and we'll be happy to address them.
Thank you so much, Dr. Sagana.
Thank you.
Appreciate it. Megan, are you available and ready?
Yeah, I'm here.
This is Megan is, why don't you introduce yourself, Megan? I think you did previously, but let's do it again. And
yeah, thanks, Carla. Hi, everyone. I'm Megan. I may have met some of you at the collaborative wide meeting. I am new to Inhale. I started in January, and I am the strategic partnership and engagement specialist. So part of my role with Inhale is figuring out all of our governance. So we are wanting to get started with a patient advisory board where we want our board to be about 15 members, and we're hoping to recruit patients from you all, from the physician organizations, and the patients who have asthma, COPD, or are a caregiver for a pediatric asthma patient or adults with asthma or COPD. So we have been working hard behind the scenes to get approvals and get through all the red tape on our end. Thanks, Jake, for sending us a bunch of information that we were able to, that helped us get through all of that. And we're going to be holding some information sessions with myself and Dr. Lagogo on September 27th in the evening, or the patients could attend on September 25th at lunchtime. So we're hoping at these sessions that we can talk through sort of our vision for the boards, the time commitment, payments, things along those lines, so that patients can really determine if they'd like to be a part of our board. And just sort of hear from Dr. Lagogo and I that we really want this to be patient driven, and having patients really leading the charge on this. And we'll sort of help them along. And I will soon be sending out some information, like our flyer that has a little bit more information and some registration links for these 2 sessions. And once we hold the sessions, if the patients are interested, we'll get a little more information on them. And we're hoping to hold our first meeting with them by 2024, just depending on how recruitment goes and everything along those lines. So that will most likely be virtual, because that'll be winter time, and I'm sure nobody wants to drive all over in the winter. So you can email me with any additional questions about how this might go. It's on the slide, but I can also put my email in chat, and I look forward to working with you all on this.
Megan, you said September 27th or September 25th. Is it actually 29th?
29th, I'm sorry. Yeah.
Okay.
So yeah, but patients come to either or. We wanted to be a little flexible with work schedules and things like that, so they can attend either session. And if they can't make either, I'm sure that I know I can take some time to meet with them.
Any questions on any of that from anybody? So more information will be coming out. And we look forward to getting these things started. So let's move on.
Yeah.
So measures and data hubs. Hopefully you've had a chance to look in and see that the enhancement has occurred. We have integrated the Blue Care Network data. There was a data refresh with our OCS measure was updated. We updated the smoking cessation denominator. We now have those, as I said, BCN patients. And there's some attribution that's been updated also. So our next one, we've talked about this before last time, we are doing the inhaler education measure specifics. They're still with Blue Cross Blue Shield for approval. As I said previously, they're clarified that billing for inhaler education is covered by Blue Cross Blue Shield. So that specific 94664 CPT. And that we know that we're going to be updating that billing information sheet. We are still talking to them about the possibility of tracking the G codes, the G9001 and G9002. And we will keep you updated on that when we find out, get that information back from Blue Cross Blue Shield. So we have that going. Portals and websites, we're still looking for feedback, what you like, what we don't like. We will be also working with MC2TD to update our admin portal, so we'll be able to track everything like they're doing right now. And so we'll be getting that capability also. And then just reminding you about the Inhale Learning, which is going to be even more important now that we do have our PCP requirements on our PO participation scorecard. So we just got, this is hot, literally hot off the press. We got these today actually from Blue Cross Blue Shield. And we've had someone like running in the background trying to get this all updated in a format that is easy to see. So we do have a link here. And where is the voice slow? So we do have the link there, so you can look at the specifics with the scorecard, remembering that everybody's moving to a scorecard process. All the requirements here. And then the scores on the points here. And the amount the possible to earn is 22. So we have that. As I said, so the new stuff here is outlined is the point system. There's going to be a request or we're going to be required as a quarterly PO clinical champion meeting, a 1 virtual check-in meeting, ensuring the practices go to the regional meetings as part of their participation requirement. There's going to be a report documenting dissemination of newsletters, initiatives, and updates, and another one working with kind of spelling out how you're working with the practices on the initiatives and challenges and successes with that. And then we'll have also a feedback session to see how things are going, how we can improve. And there are bonus points available. Then here's for our PO practice recruitment. This also is hot off the press. We have this available and a link there for you. I will be sending this all out to you via email also. Again, so some specifics here for the details. And then, excuse me, here's the point system. They will be required to hit at least 9 points in order to get the VBR. But there are 14 points available. Again, we do have bonus points, which would lead you up to that 14. And some descriptions of our activities and our people. Again, this new stuff is going to be, they're going to be asked to participate in that inhale learning module of inhaled medications, because that goes with our focus this with our measure for this year, starting in 1/1 of 24. Attend the regional meetings. That's nothing new, spring and fall. Attend one speaker series event. We'll be having 4 in the year. We are also toying with the idea of doing specific ones for PCPs and specific ones for specialists. So there might be 8 total, but they would just be required to do 1. And complete the practice resource assessment survey. And we do, as I said, have bonus points available. Coming soon, as Jake mentioned, if you were there for the earlier call, we will have a list of providers that will not receive the VBR with a rationale for why they're not doing that. We have not received that back from Blue Cross Blue Shield as yet, hopefully by the end of the week. Reminder that our next recruitment period is for specialists, allergy, peds, pulm, and pulmonary. Their recruitment opens October 1st, 2023. The agreements are due to inhale by December 1st, 2023. So the agreements in the list of providers that are going to be participating, that means also uploaded into the admin portal. And then that participation VBR for those practices, for the specialist practices, will start March 1st, 2024. Our regional meetings, hopefully everybody has received this information and received the invite. I've been seeing that the events have been, people have been purchasing, there's no purchase, obviously, those free events, they have been purchasing those or signing up to get those tickets. Tuesday, September 26th is Ann Arbor, the 28th is Grand Rapids, the 23rd is in Grand Blanc, and then I'm sorry, not the 23rd, October 3rd is in Grand Blanc, and October 5th is in Rochester Hills. We do have our regional meeting agenda here. This is our tentative agenda. We will be having, right now we're working with Blue Cross Blue Shield based on your feedback about having pharmaceutical and device reps there. We need to get their final approval for doing that, but we're hoping that people might be able to come in early if possible. We'll have registration and those tables available outside of our meeting area, obviously, between 5 and 6. And then 6 to 6:10, we'll have Dr. Lugogo will be talking with an introduction of inhale, realizing that the practices have heard from you guys, but not from us. 6:10 to 7:10, I'm going to be doing a presentation on medication devices and really how, like, that hands-on how to do it. And 7:10 to 8 o'clock, Dr. Lugogo and Dr. Schoeding are going to be talking about our measures in the scorecard. So we have a full evening that's planned out for everybody, and hopefully really educational. Our next monthly call dates are September 13th at 2 or at the 18th at 11. Are people interested in looking more at the detailing of the scorecard and the PCP requirements list right now, or just want to have any other questions that you have? If you want to share that, feel free to unmute and ask questions. If not, we will be sharing all the slides and the link, the documents with you, including I'll add Dr. Sagana's the documents explaining the process a little bit more for the MOC. And then let us know if you're interested in or if your providers are interested in MOC, so we can get that started for you. As always, we talk fast and go fast. I love being able to give more time, hopefully, if anybody, but I don't want to stop anybody if they have questions. Is anybody willing to say we're done, Carla? It's okay to stop. No questions. Or you can signal by just dropping off the call. if you want, because we're done with our slides. As I said, we'll send everything out. If you have any questions, any concerns, want to talk for a couple seconds about anything that you don't understand or want to give feedback on, we look forward to working with your practices. And let us know if you have any questions.
I think folks are dropping off the call, so it looks like we are all set. I see no questions in the chat either. Well, thank you very much for attending today. Have a great day, everyone.